Thank you, Patty. I'm Brenda Nevidjon and represent the Oncology Nursing Society organization on the forum, and I'm delighted to have shared co-chairing with Ruth Rechis.
I'm Ruth Rechis, and I am with the LIVESTRONG Foundation.
And we were supported by a tremendously talented planning group, which I believe you can find the list in your program. And my observation as an oncology nurse who really worked more with middle-aged and older adults when I was in the clinical arena, this was a wonderfully rich experience for me in terms of the very talented people who are on this planning committee. But it did remind me as a nurse, the first time I recognized some of the unique challenges of young adults was when I worked with a woman who was my age, and I was 30 at the time, who was diagnosed with advanced breast cancer because her primary care physician kept saying she was too young for that lump in her breast to be cancer. And until she developed an inversion of her nipple and they thought they should look into it, she had been being placated that it was benign. So this reminded me again of that experience, because as you can tell, when I was 30 was a few years ago. So. Just a few. So Patty mentioned a little bit about the format. After the agenda, there's some information for those of you who are tweeters, how to tweet, and some other kinds of things there. You've already heard. This is streaming live, and it will be archived. The PowerPoints you will see today will be on the website probably within the next week. So you can also retrieve that information off the website. Don't need to take a bunch of notes necessarily today. Patty did mention about we'd like to have robust conversation and have the mics. What we do ask is when you come to the mics that you introduce yourself and, if appropriate, the organization that you represent.
And if you'd like to, you could also share your connection to cancer, or if you are, as I know many of you are, like me, an adolescent and young adult cancer survivor, if you wanted to share that, we'd welcome that as well.
So you'll see that we have 5 main sessions, but we also have something that I think is going to be very special and very unique for these workshops that we typically do, and that's at the end of the day. You will be hearing from a panel of people who are survivors of adolescent or young adult diagnosis of cancer, and we're quite excited by that. So. Other comments you guys make?
We're just really think it's going to be a great day and a half, and I hope you all are staying with us through tomorrow and are excited for the conversations. The adolescent young adult oncology is a topic the Foundation has been working on for many years, and we're so thankful to the IOM and the National Cancer Policy Forum for addressing this very important issue in this population that has been so underserved in the past. So we're excited for the workshop and the resulting report that will come from that.
So now I'm going to turn it over to Ruth. You're up next.
That's right. So we'll get started with session number 1. So I'll invite our speakers to come on up. 3 folks who have been doing amazing work in adolescent young adult oncology for many, many years. So session 1, we're going to really use this session to sort of begin framing the entire workshop. So we are welcoming Archie Blyer with Oregon Health Science, and Karen Fasciano from Dana-Farber Cancer Institute, and Brandon Hayes-Latin. So I will turn it over to Archie to get started.